Let's go through the latest papers on aesthetic plastic surgery of the breast for the month of January. So to start off, we're going to go through a paper that's actually not in the cosmetic section of PRS, but in the breast reconstructive section. The title of the paper is Risk Factor Analysis for Capsular Contracture, Malposition, and Late Seroma in Patients that Received Natrel 410 Form Stable Silicone Breast Implants. The paper is written by Patricia McGuire, Neil Reisman, and Diane Murphy. And actually, it's a very interesting paper because it combines both reconstructive and breast augmentation patients, also revision breast procedures. The interesting thing about the study is that it is performed on over 17,000 patients that underwent either breast augmentation, revision breast procedures, or breast reconstruction. And what were the risk factors involved for capsular contracture? Well, the ones we would imagine that would be associated, of course, periareolar incision and subglandular placement, also older devices and an older population group. The discussion is written by Joseph Disa from Memorial Sloan Kettering in New York City, and he's an excellent plastic surgeon, by the way, excellent golfer too. As a side note, I think he's handicapped too. Excellent. Actually, really, I think Joseph Disa really, hits the nail on the head because he does comment a couple of problems that the study might have, especially with under-reporting these complications like capsular contracture and device rotation. Now, what he states is that, of course, these devices are firmer, so actually it's harder to notice a capsular contracture in a breast that's already firm, right? Actually, he states it very nicely where he says, mild or moderate degrees of capsular contracture may not be as evident as the devices are firmer from the start. This has actually been brought up before, specifically by David Hidalgo in the discussion of the paper Anatomical and Round Implants, How to Select and Indications for Use from August 2015, where he actually said, and I quote, however, if anatomical implants are more firm to begin with, perhaps most results using them start off as Baker grade 2 at best. Of course, I totally agree with David Hidalgo. They are firmer devices, and actually the use of these firmer devices for breast augmentation has been even referred to as the Barbie doll breast by Dr. Daniel Del Vecchio. And again, that's one of the characteristics of these devices. They're harder to begin with, so capsular contracture rates may be underevaluated. Okay. Also, Joseph Disa comments on the possibility of underrating also malposition up to 10 degrees or even more. Actually, can be unnoticed and not reported, especially in patients with a larger skin envelope. Okay, so let's move on, and the next paper I want to comment on is actually also on the breast reconstruction, not in the cosmetic section, but I think it's also very interesting too. The title of the paper is Cancer Risk After Fat Transfer, Multi-Center Case Cohort Study. It's written by Terence Micotin. It's actually a multi-center case cohort study from very well-known cancer centers in the US. Now, I think this is very important for breast augmentation as well. They do find out that in patients undergoing breast reconstruction with fat grafting, these patients are not at higher risk for developing breast cancer afterwards. They do show that in the population they studied of patients with breast cancer undergoing mastectomy and immediate reconstruction, that fat transfer was not associated with a higher risk of developing breast cancer. And of course, this is important for composite breast augmentation, patients undergoing normal breast augmentation in which fat transfer is also employed as an adjunct for the aesthetic result, or can extrapolate from the results of this large study that these patients are not also at higher risk for developing breast cancer. Now, let's move on and go directly into the cosmetic section because there's actually an outstanding paper on breast augmentation. It's entitled Comparing Round Anatomically Shaped Implants in Augmentation Mammoplasty, the Expert's Ability to Differentiate the Type of Implant. This is by Carlos Rubi and Jose Angel Lozano and other colleagues from Pamplona in Spain, actually, right here in Spain. And they have written an excellent, outstanding paper proving once again, I think this is the fifth paper that has shown this, that there's no way to differentiate patients that have round implants versus anatomic implants. Of course, in smaller sized implants under the pec major. No? They even have intra-observer and inter-observer kappa values, which basically tells you the study was very well performed. I think the one thing you should do is read the discussion by Frank Lista, plastic surgeon from Canada. We all know him. I think he really hits the nail in the head with this discussion. And again, as I was saying, this is already the 5th paper, I think, discussing the difficulty in assessing whether a patient has either round or anatomically shaped implants. The previous ones we'll all remember were the ones, for example, from Georgia Bronze in May 2002 in ASJ, a comparison of naturally shaped and round implants. Of course, the one from Michael Shefflin from October 2006, ASJ, also comparing round versus shaped cohesive gel implants, no differences. And of course, the Swedish paper by Jessica Gamp from November 2010, PRS. This is actually on reconstructive patients, but it also showed no differences between anatomically and round expandable implants for bilateral breast reconstructions. The 4th article actually came out as a supplement on PRS Global Open in September 2016. It's actually from David Hidalgo. We hope to see it soon in the full edition of PRS, and it was his abstract from his presentation in LA with an intraoperative comparison between round and shaped implants, actually with an impossibility to tell which side had either round or anatomically shaped implants, and this is actually a level 1 study. So plenty of evidence showing that there's really no way to tell when a patient has either round or anatomically shaped implants when a moderate device is employed in a subpectoral position. And again, the discussion paper here is a must-read. It's done by Frank Lista, the well-known Canadian plastic surgeon. And I think he really hits the nail on the head with his commentary. And I quote, "How did we get to this point? How is it that respected colleagues espouse one device over another when study after study shows that there is no apparent difference? Failure to truly appreciate the conflict that exists when financial considerations are tied to the use of a particular device plays an important role." No, I can't agree more with Frank Lista. Certainly the industry plays an important role in the decisions we make regarding the devices we choose. And it's something to take into consideration. Now let's move on. There's another very interesting paper by Bill Adams actually on the use of a resorbable mesh to provide support in mastopexy patients. Now, of course, the use of mesh has been employed before. The one that actually popularized it or has employed it most probably is Sampaio Goes from Brazil with this periareolar mastopexy combined with mesh. François Firmin used mesh for a long time, the great French plastic surgeon in Paris. But definitely I think they're coming back. Meshes can be a very good adjunct for maintaining the upper pole fullness in mastopexy patients, which of course is something that is of great debate lately, if you can actually really maintain that long-term upper pole fullness. Actually, regarding this comment, there's also in this edition of PRS a couple of letters at the end commenting on the triple glandular flap to provide more upper fullness, like an auto-augmentation procedure. I think you should read that too as well. Now let's move on to the papers on aesthetic breast surgery in ASJ this month of January. And incidentally, the first paper on this section is not an aesthetic plastic surgery paper, but as we've seen on PRS, it's a post-mastectomy reconstructive surgery study in which authors Alexandra Hart et al. Study the incidence of MRSA carrier status in patients undergoing post-mastectomy breast reconstruction. It's a prospective study. Again, there's a very interesting commentary by Anand Diva, the Australian plastic surgeon, who is regarded as one of the world experts on the research of infection and capsular contracture. So a very interesting read indeed, and again, it really dwells on the topic about how important it is to not over-prescribe antibiotics in our surgical patients. But moving on, there's a very interesting paper this month in ASJ on breast augmentation. It's actually by another Spaniard, my good friend Dr. Jesus Benito and colleagues from Barcelona. And his paper is entitled 5-Year Outcomes of Breast Augmentation with Form-Stable Implants, periareolar versus transaxillary. The study is very well carried out, and it really concludes that both approaches, periareolar and transaxillary, are both equally safe, and they have similar complication rates. He does conclude there is a higher reoperation rate, though, in patients in the subfascial plane versus the submuscular plane. So, it's a very interesting read indeed. And the next paper is a Brazilian study performed by Isaías Vieira Cabral et al., and it's entitled Increased Capacity for Work and Productivity After Breast Reduction. Now, this, of course, is one more paper that is very important for insurance companies and for the population in general to really understand that patients that undergo a breast reduction procedure really have a life-changing surgery. It's really a quality of life paper, and of course these are very important for us. Congratulations. And last but not least, there's actually two very interesting letters at the end of ASJ regarding breast mastopexy and breast reduction. It's a letter by Eric Swanson that is responded by Ruth Graf regarding the efficacy of the loop, muscle loop technique in terms of achieving long-term upper pole fullness. Now, of course, we know that Eric Swanson is very much involved in demonstrating that there is no auto-augmentation procedure that maintains long-term upper pole fullness. Now, this was actually part of his, I think, a landmark paper, his photometric analysis of 82 studies on mastopexy and breast reduction. This was on PRS 2012. I remember that paper, and actually I remember at the end of that year also the very interesting letters by Frank Lista and himself with these cups and coffee mug, showing the distortion you can have from using different lenses. I think that's an interesting discussion. Eric Swanson really has definitely thought a lot about this. He's also argued a lot with Dennis Hammond, also with his technique to achieve upper pole fullness. I think you should judge for yourself and actually read these papers. They're very, very interesting. Thank you very much, and we'll see you next month in Plastica Review for the latest news on aesthetic plastic surgery of the breast.